Hi, Dr. Sasse here from Sasse Surgical. I just wanted to talk a little bit about a topic that has come up recently in the clinic with respect to preventing rather than waiting for certain things that are obesity-related conditions from happening, and when really is the best time to intervene and kind of take more direct action with metabolic surgery, and when should a person just kind of wait and keep trying to work at it through diet and exercise and possibly weight loss medications. In this particular case, the person was developing pretty severe knee pain and joint pains as well as some back pain. And there's reason to believe that she was developing some degenerative changes in the knees based on some early x-ray changes and just really based on symptoms. And she's been carrying around probably 100 extra pounds here for quite a while, but just being in her mid-30s, felt like, you know, gosh, I'm pretty young, I don't really have diabetes, I don't have blood pressure problems, I don't have a, heart attack. As far as I know, I don't have sleep apnea, I don't have kidney problems yet, we could say, for all of those. And so, maybe it's too early to intervene with metabolic surgery. And so we talked about it, and we looked at some data, and we looked at some studies which showed what is the trajectory for people 10 years from now if, as has been studied in some large published studies, one group of people continues with medically supervised weight loss without surgery, and the other group continues but undergoes metabolic surgery today. And the reason I'm doing my hands like this is because what we find is that for the people who don't have surgery, the next 10 years are basically the evolution of some pretty serious health problems at a much higher rate. So about 7 times more likely to develop type 2 diabetes, similarly for hypertension, as well as that more or less irreversible change as the degenerative effects on the joints takes place over those 10 years. And so our belief is that we are far better off trying to intervene a bit earlier and prevent anything that might be an irreversible problem from setting in. And you might say, well, Dr. Sasse, you've told us before that the diabetes can be reversed with metabolic surgery. And while that's normally true, it's not always true. Many times the diabetes is reversed, sometimes it's just diminished and people need less medications, but it's not always 100% reversible. And the same is true for degenerative arthritic changes that develop in weight-bearing joints like the knees. That's really not reversible. You may take a lot of pounds off the body and take pressure off that joint, and that might feel better and it might buy you time before you need a knee replacement, but you would be far better off in the long term if you stopped that process earlier, and that meant having metabolic surgery earlier so that your body is allowed to fight at a lower, healthier weight during those 10 years. The other thing that came up is, well, what if I do regain some or most of my weight 10 years later? Isn't that kind of the same? But the answer is really no, because it bought you 10 full years and hopefully 20 full years of a far lower weight burden on those weight-bearing joints. And so that means a lot less irreversible and a lot less reversible damage has been allowed to accrue over those many years. Also, by intervening early, even if you were unlucky and you were unable to maintain every pound weight off 5, 10, 20 years later, there are other cards to play in the future, including revisional surgery, including new medications that are coming out, and new ways of approaching the weight problem. So looked at through the lens of kind of overall net health and trying to really avoid the irreversible damage that can come with extra years of excess weight, it's nearly always better to intervene earlier and with the very safe and relatively non-invasive sleeve procedure nowadays. Most people are far better off, healthier, and have a higher quality of life by moving forward with the sleeve procedure before those organ damage examples have taken effect. So I hope that structure and framework makes sense. That's definitely how we see it, and we believe that's how the peer-reviewed research reads if one looks at it with a sort of a open-minded approach. And we think that increasingly the sort of healthcare system and insurance reimbursement models are recognizing that with gradually liberalizing criteria for metabolic surgery or weight loss surgery. Okay, I hope that's been helpful as you think about this for you or your loved one, and with that I'll leave you and wish you the very best of health.